Hello, good afternoon friends. We are meeting today again in School of Homeopathy and we are discussing since Mother Tincture plays very vital role in palliating the conditions, and that's why in order to handle the difficult cases, the pathological cases, the Mother Tinctures have their own role. So we are discussing in our practice, and today I will going to share one of the important entity for which we get a number of patients again and again, and that is nothing but the diseases of the urinary tract. In fact, these diseases are quite common in homeopathic practice. Allopathic practice regarding treatment of all those diseases, only thing is that either antibiotic followed by antispasmodic, analgesic, sometimes anti-inflammatory, and if nothing settles, steroids. These are the basic line of treatment. But when we deal with the homeopathy, we have ample remedies to treat all those disorders. First, we'll learn which are different types of disorders of this urinary tract. So, little bit pathology we'll understand regarding those diseases. One mother tincture, and from tomorrow again. So, today regarding urinary tract diseases. The urinary tract is essentially a collecting and discharging system. There are four types or four varieties of urinary tract diseases. If we'll divide them, first variety is obstructive pathology. The third variety is the calculus formation, and fourth variety is neoplastic disease. So these are different four varieties of pathologies which we deal with the homeopathy. Out of which the first three we have to discuss, not the. So first variety, that is the obstructive pathology, which is very important, essential to understand, because lot of disorders with which patient comes to us, and there are ample remedies in homeopathy to tackle that. And second variety, that is infectious. So first two varieties today we'll discuss, and then tomorrow again the third variety we're going to discuss. There are other than these, there are few things that are relatively rare, but these are not a part and parcel of today's session. We'll start with the obstructive pathologies and how these obstructive pathologies lead to certain disorders, and because of which the diseases happens to be there, and how one can approach regarding those obstructive pathologies. Acute obstruction happens to be there generally because of calculi which suddenly gets obstructed in the ureter. So if it is complete, it causes rapid cessation of urine production both in the kidneys. So if both the kidneys are there is obstruction, it leads to renal failure also. Chronic obstruction is more common and leads to anatomical changes, and if it is ureteric obstruction and partial obstruction is there, gradual swelling happens to be there in the kidneys. The cortex, because of the renal pelvis, gets increased in size, and as renal pelvis starts increasing in size, whenever it leads to a second stage, there is thinning of renal pelvis starts appearing. It starts pressing the renal cortex over there, and when it enters into third stage, the cortex totally and whole part is swollen. There is a hydronephrosis which happens because of this. So there are three stages through which it passes. Obstruction at the ureter can lead to certain changes. So whenever hydronephrosis happens, it means that there is an obstructive pathology, and that obstructive pathology, when you find it out at microscopical level, so glomeruli gets obliterated because of that. Both changes are result of the pressure directly on the tubules, and this obstruction itself lead to a intrarenal inflammation. Urine formation may get upset over there, and it can lead, if it persists for longer time of duration, it can lead to urinary failure also, or renal failure also. So, it is quite common in obstructive pathology. And we get ample patients who are not getting cured. Repeated antibiotics were given, and by giving IV antibiotics, they never get settled very easily. So this is quite common with these people. So sequelae is that obstruction. Because of obstruction, there is stasis of urine. Because of stasis of urine, there is a urine to again a swelling, and again swelling leads to more obstruction. So this vicious circle continues to be there, and which is the big source of infection and can lead to multiple urinary tract infections. So obstructive pathology gives rise to two important problems. First important problem is the hydronephrosis, and second important problem is the infection formation. Third important thing is that the calculus and parcel effect of these things. What happens whenever there is obstruction or stasis happens to be there? This leads to alteration of the pH of the urine, and if urine becomes more alkaline, the phosphatic stones starts forming. The precipitation of phosphatic stones, and phosphatic stones develops over there. Sometimes it happens that because of continuous stasis, infection happens, the pelvis debris which develops, that pelvis debris again in the alkaline medium used to produce phosphatic stone. So that is also another effect which happens to be there because of the obstruction. So we have to understand these obstructive processes. Their obstruction might be unilateral or obstruction might be bilateral. At both levels it might be present. If it is unilateral, it is better, because in chronic phase, generally whenever it is unilateral, it generally happens that it never causes so much of trouble. But if it is bilateral, then it is dangerous. And in such types of cases, when it is bilateral, you have to think about the surgical intervention. Unilateral is always because it is above the bladder. So whenever unilateral obstruction is there, it is either on right side of ureter. And whenever ureteric obstruction is there, happens to be there at three levels. It is the pelvic-urethral junction where obstruction happens. Second is at the level of a pelvic brim it happens, that is middle of the ureter or lower third of the ureter. And last point which is there, that it used to produce at urethral level, there is a problem. So these are the three places where unilateral obstruction can happen, and it can lead to a certain problems. So causes might be a calculus, there might be a calculus in the, there might be a third inflammatory stricture which happens to be there, and fourth important point, there might be any congenital anomaly because of which unilateral obstruction can happen. So these are, if it is unilateral, to be there, and if it is bilateral is always below the ureters, that is at the level of. So if it is bilateral, then you have to find it out what exactly the cause is there. Just in the urethra also. So bladder as well as urethra, you can get the obstruction, and bilateral obstruction can lead to or can affect both the kidneys at a time. And in such types of cases, the infection can lead to both can happen. Causes, there might be a tumor of the bladder, there might be in case of males, there is a benign enlargement of the prostate, or fourth important reason is that any pelvic neoplasm can lead to obstruction at the level of bladder or urethra. So this is the quite common thing. If there is a bilateral obstruction, you have to remove it by any means, and if it is very acute, causing retention, you have to remove that by surgical means also. So you have to understand these diseases where there is a role of homeopathy, there is not a role of homeopathy. If it is unilateral, you can handle the. So unilateral obstructions with homeopathy you can handle, but if there is an obstruction at the urethral level and it is complete obstruction, then definitely think of a help of a surgical measures. First issue which I have to discuss with. Second important issue of today's session is urinary tract infections. And we get ample patients of urinary tract infections in our practice. And we have again ample remedies to handle those cases. The commonest cause is always an inflammation, that is the inflammation extension upwards from the infection of the bladder or either from the urethra. So urethra either gets infected leading to inflammation of a lung, which we call by the name of a cystitis, and sometimes if it goes or enters into the ureter, maybe because of vesico-ureteral reflux, the infection can lead towards the kidneys also. If it leads towards the kidneys, then it is called as a pyelonephritis. So in all those varieties, we have ample remedies to treat, and that's why today we'll discuss or focus on this topic. There might be a acute cystitis or there might be a chronic cystitis. Whenever there is an acute cystitis, generally the bladder, urinary bladder, shows the signs of inflammation. There are small hemorrhages which are common in edematous mucous membrane or edematous mucosa. It is quite common during pregnancy also. Then second, in males, secondary to the obstruction, that is due to the either because of urethral stricture or benign enlargement of the prostate, this is quite common. The cystitis is quite common. Obstruction generally encourages the infection, and because of obstruction, the infection and prolong the inflammatory process. So whenever there is an obstruction at the urethral level, it leads to infection and it goes on increasing. So urinary tract infections are quite common in the obstructions. Then in non-obstructive also coli. That is another important thing. And in fact, I have heard that I have not yet tried that E. coli infection are treated with the E. coli, but my number of practitioners, homeopathic practitioners, they are using this remedy, successful urinary tract infection with the other homeopathic remedies, and this remedy works in such types of cases. Even Dr. Shishir Paranspe, he has told me or shared cases in our seminars regarding the E. coli remedy. So in obstructive cases it is mixed. Sometimes protein infections, they are also common, but most common is again E. coli. Then one more thing, reflux, allowing the retrograde spread of the infection, and it leads towards the kidneys, sometimes producing infection of the kidney, and most commonly it produces cystitis in the children. Number of cases nowadays we get with this vesico-ureteral reflux in children. It has been advised in allopathic science or modern science a surgical intervention, but I am quite happy to tell you that I have treated number of cases, good response. In fact, there was one patient from Sinnar. She was brought to me. She was just 1.5 years or between 1.5 to 2 years of old, and she was brought to me with. So she was having a continuous fever and she was on antibiotics since birth continuously, and there was a pelvic syndrome along with vesico-ureteral reflux and infection, and she has advised to go for surgical intervention, and she was brought to me for such condition homeopathic remedy. The basic remedy, the whatever her remedy, it was found, I think it might be a something like that, calcarea along with Sarsaparilla, I think so, I cannot recollect, or Sina. Whatever remedy, whatever simillimum that I have given, I have started with the case and I am treating. Since the homeopathic treatment started, she never had that recurrent infection and she recovered completely, 4.5 years old, and even though she is 4.5 years old, never had problem, and in fact never required again an antibiotic in last 2-3 years. Thereafter, for any acute element, they used to come and for the treatment, but they never took any antibiotic thereafter. Another child, at the age of 4 months, I have started treatment with the similar problem, having recurrent infections, and he was on antibiotics because of fever, having diagnosed similar thing, and very successfully treated with the homeopathy with the similimum. So, surgical cases which we are treating with the help of homeopathy, and homeopathy plays very vital role. There, after acute cystitis, we can discuss about the chronic cystitis also, because result of repeated acute cystitis can lead to a chronic variety. So usually it is associated with the obstruction of the urethra. It is quite common, and this chronic cystitis, there is a stasis of urine, and because of stasis of urine, generally commonly in males, the mixed infections are quite common. There might be a protease, there might be a staphylococci, there might be a E. coli. All those mixed infections are quite common over there, and they together with forming ammonia over there, producing alkaline urine, and alkaline urine can lead to a phosphatic stones formation. So precipitation is quite common in phosphatic urine, and this ultimately leads with the infection more stronger and more permanent and without. There is one more, that tubercular cystitis is quite common. It is secondary to the tuberculosis which happens there, always secondarily. Less commonly this variety is present, but if it is present, more common in the males epididymis. So infection more commonly in epididymis can produce or can lead to this tuberculous cystitis. And last, regarding the infection which we have to consider today, is the urethral infection. Urethral infection, there are number of varieties of. Commonly we can think about gonococcal urethritis, which is most common. This gonococcal urethritis, when we think homeopathically, it is a psychotic entity, and we have good remedy like a thuja or a medorinum to tackle such conditions. One more, the cannabis sativa. Then second important is petroselinum, very essential remedies in such types of urethral infections. There are other causes such as viruses are also one of the important causes. Sometimes it is mycoplasma which can produce urethritis. Even sometimes it is trichomonal infection which is also common, producing the urethritis over there. Sometimes it is writer's disease where there is a trio which is present, that there is urethritis, there is a arthritis, and there is urethritis, conjunctivitis, and third thing, that is arthritis, that is present in writer's syndrome. So these are different varieties of infections which we can get, and these cases are quite common in homeopathic practice. So we are dealing with those acute infections, chronic infections in day-to-day practice. My suggestion is that remedy for that specific state depending upon patient's presentation. In acute practice, if you don't get anything specifically, I have shared with you one remedy, that is Uha Ursi. If you get laboratory findings in the urine, it shows multiple pus cells. Uha Ursi is one remedy which I have tried number of times with a successful result. In acutes, these remedies always help. Cantharis is one more, one should not forget. So petroselinum, cantharis, epigia, then the sarsaparilla, these are different remedies one should not forget in urinary tract infection. How I think logically, that I will share with you. Even though whether it is a patient of a calculus, whether it is obstructive pathology, whether it is cystitis, whether it is so any inflammatory focus over there, in such types of cases, Generally, I consider one important mother tincture for that case, other than whatever may be the patient's remedy. So, patient's remedy might be anything. It might be cantharis, it might be petroselenium. It depends if it is acute. If it is chronic, again we have to deal with the patient, find it out exactly. A very clear remedy of the patient. Uh, I used to use Sarsaparilla in my practice. Sarsaparilla mother tincture settles the micturition problem, burning immediately, and that's why Sarsaparilla in mother tincture are settling the patient's complaints. So you have to be, you must know regarding the Sarsaparilla. What is given in the Borix Materia Medica with you regarding the Sarsaparilla. If you open the Borix Materia Medica, the first sentence in first two words which are very important, the renal colic itself suggests that this remedy is having very typical action on genitourinary tract, and it is very essential remedy whenever the infection is associated. So it is not only calculi but renal calculi along with the infection, because it has very typical symptoms. So pains, it has been mentioned that renal colic, marasmus and periosteal pains due to the venereal disease. Psychotic miasm or psychosyphilitic miasm is covered through this remedy. It is very useful. Urine is scanty, slimy, flaky, sandy, bloody with gravel. See, this is pathophysiology. You get directly the how you can get directly a constitution or contents of the urine, or how it looks like. What he says, it is scanty, so it is concentrated and in a small quantity. Second, slimy, it is little bit thick. Flaky is again, it contains lot of particles, sometimes even sand like particles over there. Bloody, so blood particles. So these are very important things along with the gravel. So there is a calculi happens to be there. Very important things which happens to be there. Then second part, renal colic. Severe pain at the conclusion of micturition. This is in fact hint to prescribe the Sarsaparilla. That at the conclusion of urination there is a pain. It is not at the start of micturition or not. Where urine stops, then you can get this very typical sensation, pain over there at the conclusion. Urine dribbles while sitting. Dribbling urination. It passes involuntarily, dribbles over there because of infective processes. So, there is bladder which is tender, it is distended. Child screams before and while passing the urine. This is very close to the lycopodium. In lycopodium also the symptom is there. Because of the burning whenever it passes. Sand on diaper. So you can find it out, sand which is passed while infant with passing urine, and you can get sand over there. Renal colic and dysuria in infants. See, in infants, this remedy is very useful remedy. Pain from the right kidney extending downwards, right ureteric calculi or right renal calculi. This is quite common. There is a tenesmus of bladder. So spasms of the bladder because of inflammation over there, cystitis over there. Urine passes in a thin feeble stream. Pain at the. So these are very typical features which you can get in Sarsaparilla. So I generally think whenever the infective process is there, burning associated with renal calculi, I used to think about Sarsaparilla first. Even it is right-sided, even it is left-sided, I used to think about it till the urinary micturition. So during burning micturition, associated with obstructive pathologies, think of Sarsaparilla mother tincture. So this is the mother tincture I want to share with you. I have not discussed regarding the calculi in today's session. Tomorrow we'll learn regarding the different varieties of calculi and different mother tinctures to tackle those calculi. But these are the infective, and these infective processes can be settled with the help of homeopathic remedy. If you will find the miasm or miasmatic background, most commonly the psychotic or psychosyphilitic miasm most commonly appears in such types of chronic varieties of patients, and that's why your remedy should match that miasm in order to complete or the cure, or in order to get it completely free out of the symptoms. So today we have learned regarding the obstructive pathology. I know that there is today the video, there was a poor connection, internet connection which is there, and that's why it was buffering again and again. Okay, but whatever it may be, we have met together. Thank you to all of you who are watching the videos regularly, sharing the videos, and my suggestion again that all of you to go through the channel, ask the students, ask your friends to join our this homeopathic propagation on YouTube. Tomorrow we'll meet again with the renal calculi and the homeopathic mother tinctures. So thanks once again being there regularly, and those who are discussing lot regarding the number of things in group. But my suggestion is that always go for studies. It is very important for your practice. So thank you very much being there. Tomorrow we'll meet at the same time and we'll find another solution for the internet. Okay.